trigger that, or try to, what happened? What triggered and made your fingers swell up? You see what I'm saying? What did I do? Let me see. Did I stay outside too long? Now that's why my chest is hurting, because too much sun and radiation from the sun got in, and I inhaled too much of the bad, what they call when we have, we be in a red zone for the, it's too hot outside.
You mean like
you know what I'm saying? And we have to be in the house during the day. You can't come outside until the sun and the clouds cover up the sun.
Oh, wow.
And when I tell people, know your lupus, get to know your lupus. Because once I got to know my lupus, baby, that's when I grabbed it by the throat and I had it. And I'm in control of it now. I tell you when to flare up. You see what I'm saying?
That's what's up, and that's the thing. You know yourself. So like I said, I commend you what you're doing, Greta. I really do, because I didn't know anything about lupus until I met you, and I still don't really know. You know what I'm saying? I still don't really know. But I'm an advocate for it now. Because I see that. Yeah, so because I see that it's another disease that is harming our people, and we need to know about it.
And it's like an epidemic about it. It seems like it's just getting worse and worse, and everybody's just coming up with lupus. So they try to say they don't know what's causing it. So if you think about it, if it's all of us are getting it in our community, it has to be in the food that we're eating. It has to be in the bloodline. Something that was passed on to us from our ancestors. What did they eat?
Yeah.
What was y'all feeding them?
I think you say stress too. Stress may be a contributing factor because exactly stress.
Stress is another one factor. Because if you would think about it, your lupus don't flare up until you done went through something very traumatic or something very that got you so upset. It's stress. Y'all might think I'm telling a fib, but let me tell you, one night, not too long ago, this year, I saw a SUV spin out of control and hit head on into an electric pole, and the pole came tumbling down right in front of me in the street, across the whole street, and then the wire started sparkling, just sparkling like that. So I'm thinking it's going to blow up or something. So I'm like, oh my God, it happened right in front of me, right? Mm-hmm. So that was very, very, very traumatic because it happened like, and I can hear the truck hit the pole, that boom, like that, and it almost feel like I can feel that boom, like that. And that was very stressful to my body. I promise y'all, I went into a lupus flare, and I was in the hospital for 6 days.
Mm-hmm. Wow.
They can't tell me what caused the flare-up, and it was so bad like that. Mm-hmm. But once I thought back and played back in my head, I said, that's what happened.
Yeah.
Because I've been cool. I have not had any hospital stays in a while.
Yeah.
And for that to just happen all of a sudden, and I had just had a doctor's appointment and everything, and my lab was good and everything.
Yeah.
So I definitely think that's what caused it.
Yeah. I think stress
But,
caused.
and guess what the doctor would probably say? No, well, I don't think that was it. It'd be like that because you don't have lupus. You don't know what the hell you're talking about. Excuse me. But it'd be like, you don't know what you're talking about.
Yeah.
And
we like you said, we just have to know our bodies. Any disease that we are going through, you're gonna have to just know your body because every disease affect everybody's body differently.
Different. No two cases are the same, and people definitely have to pay attention.
Yeah.
And another thing, those people or those things that causes you stress and causes you to be upset, you got to get rid of it. You got to get rid of that toxic.
Yeah, I agree. Well, Greta, I thank you for calling in and
just calling in and expressing and encourage and giving us your little story and like I said, you continue to trust God. You know what you're doing, exactly what you're doing. The right thing you're doing is just trusting God and continuing to fight. Don't give up the fight.
Thank you so much for the invite. I love trying to spread the word. Thank you.
No problem. Love you.
Thank you, Greta.
Love you. Talk to you later.
All right. Bye-bye.
Bye, y'all. Bye now.
Wow. Powerful call. That was nice. We thank Greta for calling in and giving us input, especially she's going through it.
Right.
You know, she's going through lupus. So, you know, I appreciate her calling in and giving us her 2 cents. You know, her little 2 cents what's going on with her and encourage her and like I said, I didn't know anything about lupus and now I'm more. Now, this is another thing I got to learn. Another thing.
That's right.
Another diagnosis I got to learn and learn about because, you never know. Like she didn't even know. She just found out 10 years ago that she had it. Right. So it's just something that we all need to.
And even when you have the healthcare providers that don't know, then that's a problem right there.
Yeah.
Because it's hard to diagnose because it mimics other diseases.
Right.
Like
your
pain and your joints, fever. So they really don't know. It's kind of vague symptoms.
Mm-hmm.
So you have to really advocate for yourself and something's not right with my body and request more testing, more labs and things like that to help yourself.
And that's something we don't do. We don't, open our mouths and knowing there's something wrong with us and we just believe what the doctors say. And then we go back home and then we still sick. Mm-hmm. And so we just have to continue. That's what they're there for. That's what they get paid for.
We can also learn as a consumer that we're health consumers that we have to speak up for ourselves. Right. We have to. Because I would know as a nurse, but the normal typical person wouldn't know what to ask. Wouldn't know what questions to ask the doctors.
Yeah.
Wouldn't know, well, hey, there's something wrong with me. I'm telling you there's something wrong with me, but you telling me that there's nothing wrong. What test, there are other tests that I should get to make sure we know what's going on with myself.
Yeah.
So we have to be educated consumers also. That's part of our responsibility.
Yeah. Yeah, you have to pick up that book, research. Now we don't even have to pick up, but we just Google it.
Yeah, you Google it.
Right. So, Elaine, I know you're just going to be talking about lupus. I know Greta, she went over a lot of stuff, but I would love to hear your input of lupus as well.
Sure. Like she said, it is an autoimmune disease, meaning it actually attacks your body. And she said that she experienced some things as far as flares, meaning she would have to go to the hospital because maybe she was in pain or her chest was hurting. So everybody's body presents differently. Mm-hmm. So when you notice you're having something that's not going right, you need to always go to your healthcare professional. For example, like what it does usually with lupus affects your joints, your skin, your kidneys, your heart, like your brain, your blood cells. Basically, it kind of tears up your whole body. That's what it does. And it can, like I said, it can be difficult to diagnose because you don't know the symptoms are vague. So say maybe you're fine for 2 months and you kind of show up again at the ER because you're having chest pain, you're having a fever, no one really knows. So they'll do maybe some labs. It might appear to be somewhat normal, but there's nothing significant. So they wouldn't warrant you to say, hey, she has lupus at this point. So like I said, just advocate for your self. But also something that will kind of let them know you have a rash or like a butterfly marking on your cheeks. And that's usually indicative that you do have lupus. It looks kind of like, I guess, red, kind of patchy on your skin. You do see that. Some people will not have that, but they still can have lupus.
So what do you think? Because like I said, I ain't never heard lupus. Like, because like you said, it attacks the body.
Right.
So to me, I wouldn't think about if I had lupus. I'd be thinking if I had like a STD, because you said it affect the whole body. It give you a fever and you have rashes and
chest pain. You might have abnormal labs like your platelets might be low. Things like that would say, hey, something's going on with your body, so it's not acting right. And so usually they'll do diagnostic testing.
Like they can do a sedimentation rate to see what's going on with your kidney, stuff like that. Or they can do like tests with your x-ray to see if you have any fluid around your lungs, or like an EKG or something like an echocardiogram, which actually takes images of the actual heart and valves and see something that's going on, inflammation process. So lupus based is inflammation, chronic throughout the whole body. So when you do those testing, you can kind of see what's going on with your body at that point, because that's not normal to have inflammation everywhere, your whole body, because your body's attacking, it's fighting itself, it's trying to get rid of it. So that's the way it appears when you see medically looking at a person that does have it.
So what do you think they need to do? Like, what would you say? It's fighting the whole body. So
it's attacking it.
What are some things that they can do to prevent it for having flare-ups?
Like usually they say, well, number one thing is stress. Like things as far as like going outside, being like in the hot sun, those are kind of like triggers. Some people have genetic dispositions for it, meaning that they have something in their body that causes them to have an autoimmune disorder. They don't know why, but genetically they are predisposed to have it. So things like that. But you have to be able to identify, and I keep saying that, know your body. Yeah. If you're having a fever of 101, like every, 3 months, you're having pain, you're saying, I can't breathe, something is going on that's not normal, then it just goes away. So your body is trying to tell you, hey, you need to get me checked out. And most people, they don't do that. They'll just take maybe a Tylenol and go to sleep.
Yeah.
And maybe relate it to something that happened today, but it's telling you something is not right. But always request labs. If you even go anywhere, always request labs. Labs like drawing blood or taking like urine. It tells you what's going on with your body, because it's taking the actual blood from your body and diagnosing and treating and seeing what's going on with it. It can do a good job at that. So things like that.
So basically they test for your blood to see if you have
your blood to see
lupus.
if you have any type of inflammatory processes going on. They look for specific antigens and things like that, because that's not normal to have always inflammation in your body. So your body's telling you, hey, something's wrong with it.
Wow. Another thing we have to deal with. Another disease, boy, that we got to fight against. Carter, got anything to add
I
on
was just
that?
going to talk about the facts. It says like approximately 1.5 million people in the U.S. have lupus. People of African, Asian, and Native American descent are more likely to develop lupus than are Caucasians. Although it says that it can occur in both men and women, 90% of people diagnosed with the disease are women. Women of childbearing ages 14 through 45 are most often affected, and as many as 1 in 250 people may develop lupus. So 1 in 250, that's a high number.
That's a lot of people.
Right. Mm-hmm. And that's being diagnosed with it. People who actually know that they have it. You have to go through a lengthy process, and they go through different organ systems, and then they narrow it down to see if you do have lupus.
Wow, that's a lot of people that that's going through this and like I said, because I read it as well, and lupus is something it comes from the environment, genetic, and hormones. And to me, it sounds like it's something that you can't really stop. It's something that you can't, because it can be something you ate. That the way your diet is,
right?
What it sounds like to me, or the job that you work at. Warehouse jobs, where it's so much pollution, because as we know that, whatever goes inside our body is going to affect something.
So you're right. I hear what you're saying. As far as the neighborhood where we live, the jobs that we work, where we work, and the food that we eat, it's always negative.
Right.
Right. Yeah, it is, and like I said, I commend those who do have lupus, because what it sounds like to me it's your own body attacking yourself. It's attacking it, and
it slowly kills you. That's the thing, like slowly, because if you can't manage it with like medications and like they said, even getting like therapy to like have somebody to talk to, have someone to go to, your body's just killing itself slowly. Like they do like NSAIDs, they do medication you use for chemo, they do drugs like that to try to manage it, but still it's a chronic disease, and you're gonna have it lifelong. So
it's no cure. It's no cure for it. Yeah, I read that.
That's all that you can do at that point. A lot of people have it and they don't know they have it.
Yeah,
and that's the scary part. Any of us could have it in here, we wouldn't even know it.
It made me want to go get a test.
And then that's why it's so important too that we participate in research.
Yeah. As
a people.
Yeah, yeah. Y'all have, yeah, I agree. Because sometimes some researchers I be like, oh, they just wanna, you know, yeah. I don't had a negative comment about, I really not a negative comment, just a negative thought about researching,